So a radiation oncologist is a cancer doctor who treats cancer with radiation. So generally the patient has seen their primary care physician and they've been referred either to a surgeon or a medical oncologist. And generally the surgeon or medical oncologist then refers to the radiation oncologist for the radiation portion of the treatment. Radiation is a type of X-ray. It's a photon beam. And the patient lies down on a table, and we do the planning for that with something called CT planning, where the patient lies down, we bring a CT scanner over the patient, and we're able to then see the tissue densities, the tumor, all of the anatomy that we need to see, so we can avoid all of the normal tissue that we want to avoid and really come down and really define where that tumor is. In our field, first we do the planning, and then we bring it all back to, we have a lot of computer systems where we ask a computer multiple questions saying, okay, I want you to keep the dose to the normal tissue to below a certain amount. I want you to give the tumor this amount, and I want you to avoid all of these structures. And so we'll go through every CT slice and ask the computer to do that. The computer then runs hundreds of iterations until it has the very best plan. So that's something called intensity modulated radiation planning. And so that gives the very least side effects and the very best dose to the tumor. People don't want to be in pain, so they always ask, is this painful? Am I going to be uncomfortable? What are the side effects, short-term side effects? What are the long-term side effects? And we try to go through all of that in great detail to make them comfortable. But in general, radiation in itself is not uncomfortable. You don't feel anything, but there are different side effects depending on where we're treating. Every patient that we see, we make sure that they are being treated by what's considered the very best standard of care. And that's why we work with the surgeons, work with the medical oncologists to make sure that this particular patient's cancer, their particular stage, is being treated optimally. Probably the biggest advance in radiation oncology is the use of what's called intensity modulated radiation therapy planning. It's been able to decrease side effects significantly. For every patient, we also have what's called image-guided radiation, where at the time of treatment, we take a small image anterior and laterally. We superimpose those images in the computer, and so for every treatment, we can make sure that we're treating exactly what we want to treat. We also have something called onboard CT imaging. So at the time of treatment, we can actually do a CT scan right there and make sure that the tumor is being well encompassed with the treatment. We're installing right now a brand new stereotactic radiosurgery system so that we can treat both the brain and the body with stereotactic radiosurgery. It's been wonderful working with St. Joseph's. I think their support in providing the doctors with the very latest technology. I pray that I have the ability to really connect with the patient and that I have the grace to be their physician. It's really important. The mission of St. Joseph's is important to me.